Zoloft is the #1 prescribed antidepressant in the United States. A survey showed that there were over 38 million prescriptions for Sertraline written in the United States in 2022. But did you know that it can make your anxiety worse before it makes it better? Also, some people experience brain zaps when they stop it too fast. Zoloft might help your mood, but it won't fix the root cause. Before you start to stop this medication, there are 5 things you need to know. I'll also share the one mistake most women make when stopping Zoloft that can backfire. Hi, I'm Dr. A. I'm a lifestyle psychiatrist. Number 1, what is Zoloft and how does it actually work? Zoloft, generic name Sertraline, is an SSRI, a selective serotonin reuptake inhibitor. Think of serotonin as your brain's emotional messenger. It helps regulate mood, sleep, focus, and even how you respond to pain. Zoloft works by increasing serotonin levels in the brain. It does this by blocking the reabsorption of serotonin so more of it stays active between your brain cells. It is FDA approved for depression, panic disorder, OCD, PTSD, social anxiety, PMDD, premenstrual dysphoric disorder. It is also commonly prescribed off-label for menopause-related anxiety because it can calm the nervous system. But its action isn't instant, which brings me to number 2. Zoloft takes time to work, and you may feel worse before you feel better. Zoloft doesn't work overnight. It can take 2 to 6 weeks to experience a positive response. This is because your brain serotonin receptors need time to adjust to the increased serotonin levels. The increased serotonin also triggers the growth and strengthening of brain connections, a process called neuroplasticity. Changes in gene expression and protein synthesis also occur. These cellular and structural changes take weeks to develop. But here's the tricky part. You may feel more anxious or activated in the first 7 to 10 days. One of my patients, a 52-year-old teacher, said, "It felt like I had caffeine in my veins, but no focus. My thoughts were racing, but my emotions were flat." That early activation effect is real, especially for people with sensitive nervous systems. That's why we recommend a start low, go slow approach. Start at a very low dose and slowly titrate up after several weeks. Zoloft isn't designed to numb you. It's meant to help you feel more emotionally stable. But it is essential to add other treatment components such as therapy, sleep, nutrition, and lifestyle changes. Number 3. Side effects may occur with Zoloft, but many tend to be temporary. The most common side effects of Zoloft tend to be related to the abdomen, so nausea, stomach pain, and diarrhea. Other side effects include headaches, trouble sleeping, vivid dreams, emotional dullness, sweating, fatigue, and sexual side effects. In women, sexual side effects can include low libido and difficulty with arousal or orgasm. But this can also be symptoms of untreated depression. One of my patients described taking Zoloft as breaking in a stiff pair of shoes. This means you may feel uncomfortable initially, but many side effects fade in 5 to 10 days. Another patient said, "I yawned constantly for a week, but then it just stopped." If the symptoms last longer or interfere with your daily life, your doctor can adjust the dose or switch meds. Number 4. Zoloft doesn't mix well with everything. Interactions can occur. Zoloft is processed in your liver by enzymes called cytochrome P450, but it slows these enzymes down. Think of it like slowing your liver's cleanup crew. That means other medications can linger in your system longer, raising their levels and increasing side effects. This includes some blood thinners, pain medications, migraine medications, benzodiazepines, and herbal supplements like St. John's wort. And then there's serotonin syndrome, a rare but serious condition where too much serotonin builds up in the brain. It can happen when Zoloft is combined with other serotonin-boosting substances. This can lead to tremors, fever, muscle stiffness, confusion, and seizures. So always tell your doctor everything you're taking. Prescriptions, supplements, herbs. Number 5. Zoloft isn't addictive, but stopping it abruptly can cause withdrawals. Let's be clear, Zoloft is not addictive. It doesn't cause cravings. You won't feel high, but it does change your brain chemistry. So when you stop suddenly, your body can go into withdrawal. This is called SSRI discontinuation syndrome. It can present as brain zaps, dizziness, nausea, mood swings, and trouble sleeping. It can feel like your nervous system is misfiring. And here's where Zoloft differs from Prozac. Zoloft leaves the body faster. It has a shorter half-life, so withdrawal symptoms can come on quickly if you stop cold turkey. If you ever decide to stop, taper slowly with your doctor's help. Zoloft can stabilize you, but it can't heal what caused your symptoms in the first place. True healing comes from addressing your root causes. Heal your gut. 90% of serotonin is made there. Balance your blood sugar and insulin. Support your mitochondria, your body's power plant. Reduce inflammation and oxidative stress. Improve sleep, stress, movement, and social connection. That's what I teach my patients every day, because medications help, but lifestyle transforms. If you're a woman over 40 navigating mental health, hormones, or medication decisions, then you need to know about these 5 brain supplements that help you function optimally.